I see that I do have control over my health, that everyday habits do matter, that it's not all in my genes. Just because something ran in my family, it doesn't mean it has to be my destiny. That is the goal of health coaching.
Welcome back to the Alternative Life Plan podcast. I am Dr. Kristin Barnes, coming at you from Port Townsend, Washington on the Olympic Peninsula. This is where we explore healing paths your conventional medical provider may never mention. My own career has demanded creativity and adaptability to solve complex problems, and nowhere is that more critical than in today's healthcare and chronic disease. Today's guest is Dr. Sandra Scheinbaum, a clinical psychologist with more than 40 years of experience. She's a published author and founder and CEO of the Functional Medicine Coaching Academy. Together, we'll navigate the world of functional medicine and Dr. Scheinbaum's mission to train and empower practitioners. Her work is transforming healthcare by equipping providers to combat chronic lifestyle-based diseases, improve patient outcomes, and lower costs. We'll also explore her unique integration of functional medicine principles with positive psychology, mind-body medicine, and the psychology of eating, which I am really looking forward to getting into myself. So strap into your ejection seat. It is time to taxi to the catapult and get airborne. Dr. Scheinbaum, welcome.
Thank you so much for that kind introduction. I'm happy to be here.
I'm glad you're here. I stole all of that from LinkedIn. I hope that's okay. I enjoyed researching your profile quite a bit. We have a lot in common, and yet we have a lot that we don't have in common, and I'm looking forward to unpacking a lot of that. So without further ado, let's just get into, so you started as a clinical psychologist. How did you get into functional medicine?
Well, I was always a renegade psychologist when everybody was doing more of a Freudian type of psychotherapy. I was doing mind-body medicine. Now, keep in mind, this was in the late 70s, early 80s, and we didn't talk about mind-body medicine. We didn't talk about breath work. I was teaching people how to breathe, but breath work was not a word back then. And I was seeing tremendous benefit. People that I would get referred to me, they often had physical conditions. They would often be experiencing migraine headaches, for example, or irritable bowel syndrome, and found that using these strategies, these mind-body techniques, were remarkably effective. And I was pairing those with helping people to change their perspective, change the inner language, things that have become quite popular today from people like Mel Robbins. But back then, these were theories that we knew they really worked. We just didn't have cutesy names for them. And what led me to functional medicine was really happenstance. I happened to get something came across my desk. It was about a conference that was taking place. I didn't know anything about functional medicine. This was, I think, 2008. And I went to the conference and was blown away. People like Mark Hyman were there, for example, and the idea that you can identify the root cause of what was going on with somebody and not just attack the symptoms, and they would get better. And in retrospect, as I look back on the tenets of functional medicine, they're really very similar to what I was learning way back in the late 60s, early 70s, when I was in learning disabilities. That was my original master's degree. I worked with really thousands of kids over the years who were diagnosed with learning disabilities. But the system I was taught was differential diagnosis, where we would do all of these assessments. And it's not just like, oh, this child can't read, so we'll come up with some strategies for helping to read. No, it was, why can't they read? Could it be that it's a hearing issue? Could it be it's a visual acuity problem? Is it a memory issue? Is it a problem that has to do with word retrieval? So there are many different possibilities for one symptom not reading. That's what functional medicine is. Somebody would come to you and they have a rash. Well, if they are seeing a conventional physician, a dermatologist, they would get a cream. But a functional medicine doctor, for example, would say, why do they have a rash? What else is going on with them? And could we look under the hood to see what's actually the root cause of that rash? And typically it's inflammation. What's driving this inflammation? Maybe it has to do with what they're choosing to eat or not eat. And so it is looking under the hood for the root causes. And it's also a personalized approach.
So I want to go back right to the very beginning, because I mean, I was born in 1970, so I have an idea of what the 70s and 80s were like. And I never remember hearing about mindfulness until I went to medical school when did I start medical school? 2016. And of course, that's not really a surprise. I spent a life in the military, and we don't talk about mindfulness in the military. Where did that come from? How did you decide, or what was it about your experience in life that taught you that these techniques were going to be a good idea to add into what you were doing?
Well, at the time, so this was when I was in my early 20s, I used to get panic attacks. Now, at the time, I was teaching, and I was teaching kids who we now call neurodivergent thinkers. We called it learning disabilities back then. And I found that I would get these severe panic attacks where I would have to go to the emergency room thinking I was dying. Now, at the time, and this is an aside, I was also, my diet was really crummy. I wasn't working out. And so there were other things going on that were contributing to this. But one of the main ways that I learned to stop these panic attacks was not taking the medication that my doctor had prescribed, but really I found that if I understood panic attacks and understood that it's often a disorder of breathing where you're hyperventilating. So I started to take some slow belly breaths and found that I could use that not only to stop the beginnings of a panic attack, but also to prevent panic and anxiety. When I was stressed, for example, I would catch myself and start to engage in some slow belly breathing, which is how we described it back then. But that is not enough, because really, when we're talking about mindfulness, we're talking about being aware, from my perspective, is what we're telling ourselves. Because typically, let's say the case of panic attack, I'm telling myself, I'm dying. I'm going to pass out. I can't breathe. This is awful. This is horrible. I'm dying. But on a lower level, it might be, I can't, bad things have happened. I had a horrible day. Nothing is working out right. This is too hard for me to do. Those catastrophic thoughts. This comes from, I was lucky enough to be trained by Dr. Albert Ellis, who is one of the fathers of what we call cognitive behavior therapy. And so when you shift your thoughts, that is going to change your physiological state. And really, mindfulness is being aware of that stream of words that is occurring to us, our self-talk, our inner language, and we can change that. And that, as a result, changes our physiology. And so when you combine changing those thought patterns with changing something physiologically, so I mentioned breathing, but it's something else as well. You might, with that awareness of your breathing and your thought patterns, might come awareness like, oh, I am like tensing up. I'm wearing my shoulders like they're earrings. I am bracing as if for danger, because to fight or run away, it's a bracing. Every muscle often is tight. So as you become aware of that, you may shift to a more relaxed posture. Sometimes it is actually that relaxed posture is not caving in, but it's also the opposite. It is letting your shoulders drop down your back and feeling that power of straightening your spine, for example. So you put all these together and they're quite powerful. So that would be mindfulness. It has to do with just the awareness, moment by moment awareness. And as you catch, you say, oh, I don't like this. I'm tightening up. I'm going to let it go. I'm going to often squeeze and exaggerate the tightness so I can let it go even more. Or I don't like these thoughts. They're not serving me. And so how can I reframe this sentence that I'm telling myself so that it'll result in a more relaxed, so to speak, type of thinking?
I do find it interesting when I get people on my treatment table. I do a lot of body work and acupuncture. That half the fun is watching them get on the table and exhale. And they're like, I feel better already. And like, all you did was get to the table. Isn't that amazing? Let's figure out how you can do that at home and feel safe in your own space. I, as a naturopathic doctor, I don't know how familiar you are with naturopathy. I'm assuming that you probably are. A focus on finding the root cause, using natural remedies, plant medicine, and that sort of thing. I think one of my issues with functional medicine is the way it's been commercialized, and you have these companies that run, $2,000 or $3,000 of labs. And I recently had a patient come back with a series of lab tests. They're like, interpret this for me. And first of all, I'm like, well, why hasn't the person who's charged you $3,000 interpreted this for you? But I also noticed that there were some markers that were completely overlooked. I don't need to get into the details, but I find that frustrating that they're running all these things and then they're not actually getting the benefit of the information that is like the nuggets that are in there. I'm curious what your thoughts are on that and how you go about addressing that maybe.
Yeah, I think there's a real risk of too much testing and information that may become noise after a while. And what we're seeing particularly is a growth of direct-to-consumer tests. And I think it's just in its infancy, but one of the challenges is that people get these tests and their AI-driven results. And let's say their food sensitivity tests, their stool tests, microbiome analyses, their comprehensive testing, and they often freak out. Like, they will immediately go to ChatGPT or Google and they will identify, oh no, there's something terribly wrong with me, for example. Well, that may not have been the case at all. And one of the things that we know about testing is that it is a snapshot in time. And so if you and I wear a continuous glucose monitor, and I'm not diabetic, but I really like to have that data. But sometimes I have to tune it out. And I know what causes a spike and how that's normal. So, for example, we're talking right now, and if I'm speaking in public, that's often one of the highest spikes that I will get, higher than eating a piece of chocolate cake. And that is something that I understand it, and I understand that I can get it to lower. But many people don't understand this. And so they have all of these tests, particularly, which can be quite pricey. And I think their test don't guess is important. But there's also the other side to that, and that is, how can you use the data? How do you understand the data? And some things we just have to say, I don't know. There are many times, and thinking has changed. So we look at the guidelines for example, hypertension. Well, they shifted. And so often there might be some things on these reports that are not understood, or they seem alarming, when often the body just takes care of these things on their own. So I think that is one of the issues with some of the functional medicine providers. But I think when that happens, to be able to go back to the practitioner and say, what does this mean? What do you think about this? The real importance of testing is in the retesting, where you are tracking changes over time. And we train health coaches who are not, that's out of their scope. They are not allowed to order tests or interpret tests. What they do is help people to navigate this increasingly confusing world of testing and help them be their own health advocate and help them track. So you use the test as trackers. Well, somebody buys in, well, I'm going to go off gluten, or I'm going to start to take a walk after dinner. Then we can track and we can see, well, what happened to those numbers on your lab test. So I think that's the best way to use those tests, is to track. But many people are over-tested, and then some people are never tested. For example, there are things like if they're going to a doctor and they're getting, let's say, fasting blood sugar levels, but they're never getting a fasting insulin. Their doctors are not doing these pretty simple tests, or testing vitamin D levels, for example, those things that should be part of every lab workup.
There is nothing. Well, there's a lot of things that are frustrating about the conventional system to me, but the fact that vitamin D is still not covered by insurance is mind-blowing to me. Drives me crazy. Anyway, I could go off on a whole podcast about just that. So one of my recent episodes, I had a guest on who is getting into the health coaching business, and it was more based on mental health type coaching. I'm curious because you have this academy, right? That you train other providers in how to be functional health coaches. What does that look like for somebody who uses? I got to be specific here, not the student, but when the student graduates from your program and then takes that information out to give it to clients, what does that look like for the client, and what kind of benefit does that give them specifically?
Yeah, so the coach is the one who provides the support. I like to say they bring back bedside manner. They are not, we have many people who have a background in healthcare. Many are physicians, retired physicians, but we have many completely new to the field. They have no training whatsoever or degree in healthcare. They often make the best health coaches. Why would that be? Because the specialization in health coaching is listening, is helping people to reach that point where they feel understood. And based on the questions that have been asked of them, it's a complete turnaround. So it's not that and they're not called patients when they see a health coach, because they are not practitioners. They're clients, to distinguish that. So when a client is working with a health coach, it's not the client is asking the health coach questions like a patient would ask their doctor. It is reverse. It is the coach who is asking the questions to that client to help them arrive at a place where they have this big aha moment. I'm ready to change. I see that I do have control over my health, that everyday habits do matter, that it's not all in my genes. Just because something ran in my family, it doesn't mean it has to be my destiny. That is the goal of health coaching, to help people reach that level, to ask the right questions so that they meaning the client, are starting to challenge their beliefs about what's possible. And then the coach is the one who is along for the ride. It's like they're doing a dance, but the client is taking the lead, and the coach just follows. So the client may say, okay, I'm ready to start walking more. I'm going to come in. I don't have great shoes. I'm going to go out and get some. And every day, no matter, I'm going to walk. And there might be obstacles. Well, what if they live in a place where it's not so easy to just go out and take a walk? And so how can they make that happen? What would that look like? And so it's often problem solving, overcoming challenges, but it is never the coach who is the one directing, who's coming up with the plan. That's what the experts, that's what the doctors do. The coaches are the ones who help people carry out that plan, tweak it, because often people will go to a doctor, even like they'll go to naturopaths, they'll go to functional medicine doctors, they'll get recommendations, and it might be overwhelming. They don't follow through. And often it's because they see that doctor as an authority figure, and they are not going to disclose, maybe because they're embarrassed, maybe because, particularly older populations, or particular cultures, they might be in a waiting room, they finally get to see the doctor, and they're thinking, oh, this person's rushed, they don't have time, this is a silly question, I don't have to ask it. and got a waiting room full of people, and maybe the doctor is giving unknowingly signs that they're rushed, or maybe they're told by the administration if they're based on part of a big conglomerate. You only have 10 minutes to see somebody. You can only talk about one thing with your patient. You have to document it all. And so the modern healthcare system is really broken down. So again, the health coach is the one that's bringing back that bedside manner. That means they show empathy, they build rapport, and they really sit with somebody, make eye contact, and help that person feel understood so they can take charge of their health.
It is so unfortunate that that is missing from our current healthcare paradigm. I do take pleasure in, so I spent a total of 27 years in a uniform between my time in college in a military academy and then 23 years in the service. So I have done everything I can not to wear a uniform. I had somebody come into my office the other day and she looked at me and she's like, are you the doctor? Like, I have, especially living out here in the Olympic Peninsula of Washington, we're a little bit more laid back. And so I have a tendency to wear flannel and flip-flops, not when I'm doing acupuncture, but it helps disarm people a little bit, and they come in and they like, okay, this is somebody that's a little bit different. You brought up something earlier that I think is really important, and when people start talking about taking charge of their own health and having advocacy for their own health, genetics seems to get in the way because people have this belief pattern around what genetics is and what it means to our health. I invite you to go a little bit deeper into what, from your perspective as a health coach, what does genetics mean when you have when you have clients come to you and say, well, it's in my genes. What is your response to that, and how do you educate them?
Sure. Well, first of all, I want to thank you for your service.
You're welcome.
For your service. What I always say comes from something I originally heard from Dr. Jeff Bland, who's the father of functional medicine, and that is your genes load the gun, but diet and lifestyle pull the trigger. And so it's important to know your genetics, and that's getting affordable. It used to be get your whole genome was out of everyone's budget, but now you can get a lot of insights. And for example, I know that I have a long history of people who suffered from heart disease, and so as a result, I have cousins. Some are physicians, and they have been on statins for, since early. And one is, I just heard he even put his son, who is in his early 30s, has no evidence of cholesterol issues, but as a preventative. They're so convinced because of our family history. But because of the family history, I go out of my way to focus on diet and lifestyle, particularly exercise. So the importance of exercise. I know my VO2 max. I take certain supplements, but also I know that, having been a psychologist specializing in stress, I did a research project on what was at the time in the 80s called type A behavior, and it's that getting angry, getting upset. That was often a critical factor that drives inflammation that has been connected with heart disease. So there are things that you can take. So feeling like you can make these steps that can override your genetic history, I think is critical, as opposed to, well, it's just in the genes. There's nothing that you can do about it. And we're finding more and more that, yes, you can. For example, the work that Dr. Dale Bredesen and others are doing on prevention and even reversal of early stage Alzheimer's disease that has to do with lifestyle. There was just a great study that came out that showed that added to the growing body of literature showing this is something we have control over, as opposed to the attitude which I hear from so many of my contemporaries, and that is, well, it's just, I have family history, so it's inevitable. These are things that just happen to you because of your genetic makeup.
I love to challenge patients with that.
One of the things that I think it is helpful for when you get do genetic testing, finding out things like I could never understand why I would, let's say, go to a party and people would be drinking wine, and would have like a little, like a thimbleful, a little sip, and I would be just basically not feeling like drunk from this tiny little bit. And because that testing can show I don't have the enzyme that breaks down alcohol. So that's something where it's pretty clear, for example, or I'm a fast metabolizer of caffeine. So I can drink caffeine later in the day and it won't keep me up at night. So these are some things that are little tidbits, helpful things that can help you drive behaviors. But in terms of these bigger patterns, that's where you say, okay, I'm at risk. But I am going to do everything I can to mitigate that risk.
I think it's important to remember with regards to genetics that we don't just pass down family genes, we pass down family lifestyle, we pass down family belief patterns, we pass down, were your parents smokers? How did they eat? Were they drinkers? And I think all these things really greatly influence us as we're young children growing up and learning how to take care of this body on planet Earth. So it's not just, it's like you said, it's a loaded gun and the things you do are pulling the trigger. Well, what's being passed down in the family that's pulling the trigger, and it's not necessarily the loaded gun itself. So
such an important point.
Yeah. I would love, so we're about halfway through. I would love to dive into the psychology of eating. I frequently see people who have disordered eating patterns. They have a history of eating disorders, and it's a unique challenge for people because we can live without alcohol, we can live without cigarettes, and we can live without other things, gambling and whatever else we can be addicted to, but we cannot live without food. And I'm curious what your approach is with trying to coach people who have a history of disordered eating or eating disorders.
So I think it starts really with a sense of this is a topic that is very complicated. There's no one size fits all answer, and it often has to do with the messages we get from our society, from our culture. I grew up in the dieting era. I'm reading a book right now, and it is about the fashion industry, and they mention Twiggy. I hadn't thought about that in years, but in the 60s, Twiggy was a model, and I was coming of age at that time, and I remember we all wanted to look like Twiggy. In fact, there was a style of posing that she had where it's kind of round shoulders, you look even thinner than she was. And so it is that sense that you're never too rich or too thin. The fat-free craze that caught on in the late 80s, by the 90s, that was it was fat-free was everything. And so a lot of the messaging, a lot of the products available but it was all about the diet industry, which is truly an industry where you had Jenny Craig and Weight Watchers. And so the focus was on the scale. And we didn't know any different. I remember waking up, weighing myself, and I was never really obese, but there were times when I would have been considered, I'm very short and a bit overweight, but I was metabolically unhealthy, didn't know it. I was binging on sugar, but didn't really realize what that would do to me. And it was all about surface level appearances. Well, I'm going to there were some crash diets, and that will result in, losing 5 pounds. There's always lose 5 pounds, gain 5 pounds, back and forth. And until I finally started focusing on nutrition, eating for health, as opposed to weight, a number on a scale. But I still see, and I'm 75, and I unfortunately see so many of my contemporaries, women in their 70s, who still think it's about weight. And this is a big concern. But the psychology of eating is pretty broad. So it is a spectrum, and there are people who have true eating disorders where they fear eating and they become anorexic. or people who are bulimic, who are binging and purging. But often the binging, like the binging that I was doing, for example, had to do with just lack of awareness. Like I would sit down to write a paper in college, and I would have a bag of M&Ms, and oh, I finished the whole bag. It was not being aware of what I was eating, and then being really addicted to sugar because it hijacks your brain. There's been studies that show it's more addictive than cocaine. And so it was craving sugar. And when you are working with someone, it's you look at the whole picture, because maybe they have these cravings because they're under eating protein, which is certainly something that I was doing. But also to talk, this is something we train our health coaches to ask about what it was like growing up, early messages about food. Were people on a diet in their family? Were they strongly tied to tradition? And I think that is really big. So it's your family tradition, it's your friends. I recently looked at a picture of some people. These were not my friends in high school, but they were all friends. And they shared a picture online on Facebook. They were having a get together. And I looked at that picture and I thought, they were very close friends. And they all look the same. They were all had that same kind of like look of, they were metabolically unhealthy. And we tend to eat as our friends eat, and also in our culture. So even our region. So, I'm in the Chicago area. So deep affinity for deep dish pizza, for example. Where you are, you probably have favorites, or you said you grew up in the Midwest. There are patterns of eating. If you're from Louisiana and you are from New Orleans, well, how you eat, and also holidays and traditions of, I was a few years ago, I remember being at a Cubs game with my husband, and he was eating some peanuts. And I said, "Why did you buy that? You never eat peanuts." And he said, "Well, it's a ball game. You have to eat peanuts." It's like we have holidays associated. It doesn't seem right that he's a race car fan, and so he would watch the Indy 500, and he would go out and he would get a bucket of fried chicken, even sitting at home. Well, why? Because he associates that when he went to the races, actually in person, that everybody gets fried chicken. So these traditions die hard. And often when you're told by a provider, or a nutritionist, oh, you shouldn't be eating a certain food or a certain pattern of eating, very hard to break because of culture. One of the functional medicine faculty members that we have talks about, and she's from India, and she said, she has these patients, and they are metabolically, they're type 2 diabetic, but changing is really hard. And they often say, I will not change the way I cook. I can't cook for my family any different way. This is the way we've always done it. And so those patterns are very deeply ingrained and hard to change.
Yeah. One of the struggles I think my patients have is a lot of them are older women, and they're cooking for families, and they don't have the ability to, in terms of bandwidth and energy, to cook something completely different for themselves than they're cooking for their families. And so it makes for a really tough situation where they're kind of forced to eat what they're serving, what their family is willing to eat. But that's part of the journey, I think.
Yeah. Another thing that comes up that I feel with that population, and I see it with my contemporaries, and that is they have cooked for their family. Now they may be in a retirement community, or just their children are grown, they have grandchildren, and it's all about going out to eat. I know people who eat all 3 meals out. They'll go out to breakfast or brunch, and they'll go out to dinner because they said, I'm done. I gave up my pots and pans. I don't cook for the holiday meals anymore. I want to enjoy my life. And they associate that enjoyment with going out to eat. And often they are not savvy, aware enough, or bold enough I'm very troublesome in restaurants. When I come into a restaurant, they better run the because I'm going to ask about seed oils and gluten and dairy and how it's prepared. But most people will just order right off the menu, and they might be very clueless. And there's been some concern about the higher frequency of eating out in restaurants, often the more challenging, and they don't necessarily even have to be fast food restaurants, the ultra processed food, and just be even a higher level, even gourmet restaurants are not necessarily healthy.
Yeah. So living in the Pacific Northwest, particularly on the Olympic Peninsula, which is on the northwest part of the Northwest, I think it's ingrained in our culture. Farm to table is so big here that even when you go out to just regular, quote unquote, regular restaurants, that's part of what they advertise, farm to table. And so it makes it a lot easier for us to make good decisions. And I actually have to go out of my way if I want to go buy a bag of Fritos at Safeway or something.
Oh, that's great.
Yeah. So you brought up the point about being metabolically healthy, and I'm kind of a fan of this health at every size concept that has come out. I'm sure you're familiar with that as well. And I'm curious because we're so judgmental about people that carry bigger bodies than others. And what are your thoughts on being metabolically healthy and yet being outside what would conventionally be considered the norm as far as what's acceptable for weight?
Yeah, I think that it's very important to see this as a continuum. And so at the very extreme of both ends would be unhealthy. And you can assess that with body composition analysis. So there might be, and looks are deceiving. And I think that's the main point. So somebody who is a bodybuilder, a wrestler, and somebody who is big in terms of what the scale says, their BMI might be really high. But if we did a further analysis and looked at their body composition, they have skeletal muscle and they're strong. And so they're not unhealthy. But somebody who does not have that skeletal muscle, does not have that strength, and is also, in terms of those lab markers, who might have a high level of inflammation. So you look at their HSCRP and their inflammatory markers, and are they inflamed? And what is their diet like? So that first example I gave, if they're eating a ribeye steak and they're doing okay and their labs are good, well, that's different than somebody who might weigh the same but is very under-muscled and is eating that ultra-processed food, and so that's not serving them. And it's also altering their decision and hijacking their taste buds and messing with their appetite. But I think we often ignore the other end of the spectrum, and I was one of those, and that is the skinny fat, or the SOFI, skinny on the outside, fat on the inside. I see these women all the time. I just saw one the other day who was, people would say, "Oh, you're so thin," and to be admired. They may wear a small size. Their body mass index could be really low. But if you do a body composition analysis, they're under-muscled. They don't have muscle. I take ballet class, and I see a lot of these women who are older women, and they don't have muscle, and they don't have strength. And though that becomes as deleterious, potentially more, because they become frail. And frailty is a real risk factor. You don't want to fall down and break a hip. And a lot of these people, my contemporaries, they can't get up off the floor. They can't get up off the toilet seat. They are under-muscled and they don't have enough strength. And so I would look at those two ends of the continuum as being the extreme, and then more towards the middle. And the focus is not on the weight. The focus is on maintaining or not losing and possibly even building skeletal muscle mass. And I love to say I'm a perfect example where I was very under-muscled. I said, I got to do something. And I got really serious when I turned 70. It was during the pandemic. And I'm just going to do push-ups. I'm going to, how many push-ups can I do a day? And wall squats, and as much as I could do with my own body, and then got into, more recently in the past year, more seriously into deadlift and barbell squats, and the room in the gym where the women, certainly in my generation, that was the no-go zone. That was for the
Yes.
bodybuilders, and we had the little pig weights.
I love that for you. That is so awesome. I still lift with a bar and heavy weights. I have a gym that I am in regularly, and I love it. I encourage all women of any age to, don't lose it. But if you do, then it's never too late to get back out there and put it back on.
It is. I put on 6 pounds, 7 pounds of muscle. I started tracking in 2016 with an in-body scale at a conference, and then, whoa, I got 6, 7 more pounds of muscle, um, and basically same weight, gained a pound or two, but basically it's, yeah. And I go into the gym, and I see the women on the treadmill, on the elliptical, and if they go into the weight room, they'll just like do one set, really, really light. And yeah, I love it. I just, within the past year, I started using a Smith machine and just became addicted to that feeling of strength. It just feels so good. So, and I look at all the guys and see what these young guys are doing. Oh, maybe I could try that.
Well, in a culture also that says that older women are supposed to be weak, I love to challenge that belief pattern. Like, oh, really? 'Cause step out of the way while I do my pull-ups. So we only have a couple minutes left, and I didn't send you a note on this, but it came up, and I would love to chat about it as long as we're talking about older women. A lot of my patient population is postmenopausal, and I'm curious how that fits into coaching. One of my issues with menopause is that we don't talk about it enough, and people don't understand. Like, it's a change that's as big as puberty, and yet we know nothing about it except for what women whisper around in book circles and stuff. But how do you approach that, and how do you teach about it so that people are more aware of what's going on with women who are in this phase of their life?
Yeah. So for coaches, it's providing education. Often education about the dispelling the myths, like the Women's Health Initiative study, which we have a whole generation of women lost to hormone replacement because of that study, and many doctors against it as well. So coaches can provide that education, and they can help people feel empowered, where they could go to a practitioner, they can find a naturopathic doctor, and they can get what they need. They don't have to suffer. And also that this is something, there's a lot of concern about osteoporosis, and again, about frailty and about dementia. And so looking at what you can do, I think the bottom line with this, and it applies to menopause, is that it's let's not focus on the negative. How can this be a time in life full of possibilities? Now, I started Functional Medicine Coaching Academy. I was 65. I had been a psychologist for many, many years, and people said, well, what do you need to do this for? You can just, retire and maybe continue to see a few patients. But this is something that I see often women are just holding themselves back from what they want to do, having meaning and purpose in their life, being curious, learning new things. And it absolutely starts with a mindset that I can navigate whatever challenges come up, whether physical, mental, cognitive, emotional. I can really look at where I want to be, and then find the right help to help you get to where you want to be. And that's really the role of a coach. The coach is your helping you navigate and providing that support and helping you feel heard. Because I think we've just been in an era where women of this age were not heard. Or they're focusing on externals. They're focusing on, they're lured in by Botox or other, things, and now it's peptides or whatever the latest craze is. And they just go to these things, and through social media influencers, for example. But it is really, how do you look at these essential lifestyle factors and address that, which is what you're eating, moving throughout the day, addressing sleep, meaning and purpose, relationships in your life.
That's a big one. I have a number of patients who are well north of 70 into other decades and are retired and really struggling with not having a reason to get up in the morning, and talking them through, okay, first of all, don't take this lying down. Let's help you solve this. But helping them work through that, I think, is a big part of making the last decades of their lives just super meaningful. And even if they're not able to, a lot of my patients have chronic pain, even if they're not able to move as much as they want, but still making it meaningful and getting a little bit of joy out of their life. Yeah. Okay, we are about at the end of our time. I have really enjoyed breaking down some of these things with you. So much work to do out there with any one of these topics that we discussed. So thank you for sharing. Thank you for being on the show. And I'm glad we got a chance to introduce you to another audience.
I want to say this has been a delight to get to know you and talk to your audience. So thank you so much for having me.
You're very welcome. Dr. Scheinbaum, where can people find you if they want to learn more about either getting coaching or how to become a coach?
Sure. They can go to our website, functionalmedicinecoaching.org. The entry requirements are really minimal. You don't need to be a college graduate. You don't need a background in healthcare. You don't need to be of a certain age. We talked about those older folks, those older women. Become a health coach. We have women in their 80s who have long been retired, and they train to become a health coach. One in a retirement community. Personally, they can find me at Dr. Sandy, that's DrSandi, on Instagram primarily, or LinkedIn, as well as Sandra Scheinbaum. And you can find my book, Your Health Coach Will See You Now, on Amazon or barnesandnoble.com.
Fantastic. I mentioned earlier that I'd had another coach on the show with me, and we decided that we need a better word than coach because it doesn't quite capture the need and the community that can be created by working with somebody who's just a humble coach. So thank you for that. If you are in the state of Washington and you want to consult with me on all your naturopathic and Chinese medicine needs, you can find me in person in Port Townsend, but I also do telemedicine. So look me up. We can do treatment remotely. So meridianpassagewellness.com. That's me. I am on Instagram, Dr. Kristin Barnes, and I'm on LinkedIn and Facebook and all the social medias. You can't help but find me. So what are you waiting for? Get out there and make connection with either one of us and get your health journey going into the positive. So that's all we got for you today. So if you like what you heard, please share, like, subscribe, all the things that helps generate social media and generate traction. And thank you for listening. That's it. We're gonna go ahead, and this is where we do all the Dr. Scheinbaum. We do all the silly naval aviation speak. We're gonna bring it into the pattern and bring it back in for a successful landing on the aircraft carrier. So thanks everyone for tuning in, and have a great day.